Hi, my name is Stefan Mujai, and I'm here with Dr. Russell Lamboy of Lamboy Family Chiropractic in Farmingdale, New York. Um, Dr. Lamboy offers BrainCore neurofeedback, which is a really unique alternative therapy for traditional ADHD medications and other sort of therapeutic approaches. And what I wanted to have Dr. Lamboy share with us today is some alternatives to managing adult ADHD rather than prescription drugs and medications that may have some concerning side effects on your body and mental and emotional state.
Sorry.
I can see you adjusting the camera there, yeah.
Sorry with that.
That's all right. So, Dr. Lambo, if you want to kind of introduce yourself and maybe mention what BrainCore is and how neurofeedback can help with adult ADHD management, and also for kids too, but we'll focus more on adults right now.
Okay, BrainCore Therapy, it is neurological re-education. So basically what we do is we find out which brain waves, and I'm sorry everybody, I'm trying to just fix this real quick. There we go. Sorry with that. There it goes. Pull up.
Oh, perfect. Yeah, that's great.
What we do is we work with brain waves. So we find out exactly which brain waves you have too much of or not enough of. Okay. Now everybody has the same 4 basic brain waves: alpha, theta, delta, and was alpha, theta, delta, and beta. I guess I must have said it twice. I don't know, but I think that's all of them move. So each function of the brain has its own job. So what we do is we kind of locate which brain wave there's too much of or not enough of. And from that, we can kind of see our protocol on how we would treat the individual. Now, it's a 30-visit program. Each visit is about 30 minutes long. We do 4 QEEGs, and the QEEGs are all quantitative. So we basically, every time we take a new QEEG, the computer is calculating it to the prior Q. So we're always seeing exactly if we're getting better and exactly how much we're getting better.
Okay, and do you want to, just for those who may not know, kind of mention what a QEEG is and how that works in layman's terms?
QEEG it's quantitative electroencephalogram. It's just a 12-minute test. We put a cap on the head, and we're testing each part of the brain: the frontal lobe, the occipital lobe, the parietal lobe, each section of the brain, because each section has its own function and its own job. So we want to see exactly what's going on in the brain with that.
Okay, and so then if I'm like an adult and I've been, struggling with ADHD, whether maybe it's trouble focusing or my interpersonal relationships, perhaps I'm just taking medications and drugs, I'm kind of tired of the side effects and feeling jittery or not, losing weight, perhaps, any of those sorts of things. My brain waves, you're saying, basically are kind of out of sync from what they would normally be if I didn't have ADHD. Is that right?
Would they be out of sync if you didn't have ADHD?
Well, they're out of sync compared to if I have ADHD, my brain waves are out of sync, whereas, as compared to someone who...
Right. Well, a certain brain wave. Let's say, like children with ADD, their theta waves will be super high. And that's going to tell me, okay, theta wave is what controls them paying attention, them focusing, the brain slowing down. So that wave is going to tell me that this is a problem. Beta waves are for migraines or fibromyalgia. So we know if we have a high beta wave, then we know that's what we're working with.
Okay, cool. And so then, how does neurofeedback and BrainCore neurofeedback and at your clinic, Lamboy Family Chiropractic, how does that? How do I kind of mitigate the symptoms of my ADHD through neurofeedback and knowing how my brain waves are kind of operating and which one is maybe dictating this condition or behavior that I don't I want to get rid of?
We would do that QEEG. Is that what you're asking? We do the Q, and the Q is going to determine if this program would actually work for you. Not everybody gets accepted to the program, so we'd have to do the Q first, and the Q is going to determine if this is something that could help you out.
Right, but then what's the actual feedback part? What do I do if I'm going to different sessions? Like the QEEG is a first step, but after that.
Once we find out if you're a candidate for the program, we would start the way the program is done. You'd come in. We'd already know which part of the brain that we're going to be focusing on, and from there we put you in front of a computer, and you're going to be watching a movie. It could be any movie. It could be Ghostbusters. It could be Terminator. It could be whatever you like. And we're just going to ask you.
Say
Say it again.
So the Notebook, but I'm just joking.
Yeah, if you like that. Basically, we find out which part of the head we're working with, and we have you watch that movie. And all we ask is just for you to relax, breathe, and just kind of let everything go. And as you're watching the movie, your brain's going to do whatever your brain wants to do. So you're going to see the picture either get brighter or darker, or bigger or smaller. That's the feedback back to the brain to realize, hey, you don't have to function here, you can function here. So typically, while it happens in a half-hour session, about 300 times. So again, it's just retraining the brain how to function. So it's going to get bigger, get smaller, get brighter, get darker, and you just got to breathe. It's all about breathing. And it's a 30-minute session, 20-minute session.
Cool. And what kind of results do you typically see? Do you find that this tends to be effective? For adults and also children with managing their ADHD?
Yeah, right now we're having about an 80 to 85% success rate. Now you're going to say, what is your success rate? Well, how do you judge it? We judge it on those Q EEGs, because remember, we're doing every 15 visits, we're doing another Q, and the computer's comparing it to every time we did the Q before. It's coming up with the improvement numbers.
Cool. I mean, well, that's awesome. And again, just to stress it, because I think it is so important, one of the really cool things about BrainCore neurofeedback is that there's not drugs or medication. There's not documented side effects. Or not even documented. They've looked at it. There's not really ever been a case of a severe side effect.
The only side effects that we've heard so far is that the children or the adults that are taking the meds that they are on, they see the side effects more because the BrainCore is working so well that it's bringing out more of the side effects of the medicine they're taking.
That's fascinating.
They'll get more, they'll be agitated easier, they'll have more migraines. All those side effects come in because it's putting everything back in place.
Right. But then ultimately they can reduce their dependency.
That's all. Yeah, that's our goal is to get them to lower. We can't tell them to come off their meds, but our goal is every time we do another Q, we want them to go back to their neurologist and see if they could lower the dosage, so they could get themselves off it. But we can't do that. But we could actually have them send them back so they can get that lowered.
Sure, absolutely, and I think that that's really important. Someone who's been on ADHD medication myself, I can attest to it. It sort of changes your personality. In a negative way sometimes. It can affect your eating habits. It can make you feel like you're on drugs because you are on drugs. And so if there's a way to sort of alleviate the need to do that and to live a great high quality of life without struggling with the effects of ADHD, and I think that is something most people are interested in, and that's what BrainCore does. So awesome, cool. Well, thank you for sharing this with me. If you are watching this video and you want to learn more, you can go to braincoreny.com. You can also go to Dr. Russell's website. What's the URL for that one, Dr. Russell?
LamboyFamilyChiropractic.com, or you can go to Facebook, which everybody's on. Go to BrainCore Therapy of Farmingdale.
Perfect. Yeah, and you're in Farmingdale, New York. So awesome. All right. Well, thank you so much, Dr. Lamboy. I really appreciate you taking the time.
Thank you very much. Have a wonderful day.
All right, you too. Thank you.
Bye-bye.